Hello, and thank you all for joining us today for our presentation. My name is Dan, and I'm here with Kate. We are the ICS ACP leads for our respected areas, and we're going to talk to you today about a new way to connect via the integrated care system. This might be a new term to some people, and we hope by the end of the presentation you'll get some idea of what the ICS actually is and also how it affects us in advanced practice. So following several years of locally led development and recommendations from NHS England, 42 integrated care systems were created under the Health and Care Act of 2022. Each of these integrated care systems has an integrated care board, and these boards represent the local NHS bodies. They've been developed to help bring together and meet the needs of the local population and manage the local NHS budgets in arranging the correct healthcare provision for that local area. Within the Midlands, we have 11 ICSs. So think of it as a big jigsaw puzzle. We've got lots of organisations, lots of bodies, systems, all working separately. And actually what the ICS aims to do is bring those bodies together in a big partnership under one integrated care board to basically pull all that jigsaw puzzle together to look at the solutions of how we can help our local population, local needs, and manage our money to meet those local needs and population demands. So, who is included in our integrated care system? So, as mentioned, we have some statutory bodies and committees. So, the Integrated Care Partnership, so the ICP, is a statutory committee that was jointly formed between the NHS Integrated Care Boards and all the upper tiers of the local authorities that fall under the ICS areas. The ICB will bring together a board alliance of partners concerned with improving the care, health and well-being of the local population. It is the ICP responsibility for producing an integrated care system and how that actually looks in helping form the health and well-being of the local needs and the local ICS. The Integrated Care Board is a statutory NHS organisation whose responsibility it is to develop the plans to meet these health needs and population. The Integrated Care Board will manage the NHS budget and will arrange for provision of health services within the ICS. The establishment of the ICB resulted in the clinical commissioning group, so the CCGs, being closed down. So this is why they now look after the NHS budget for the local population. Also within the ICS, we've got the local authorities that help look after the responsibilities of the social care and public health functions, and they're integral into making sure that all the health equalities and within the areas are all being looked after, so form a crucial part of the ICS. And saying that, we've also got the place-based partnerships, which will help design and deliver the ICS visions, and also the providers being involved in that conversation and making sure that we disseminate everything down to the local population, making sure our patients are at the forefront of everything that we do.
Hi there. So as Dan said, this is very much about partnership and collaboration to collectively plan and deliver joined up health and care services to improve the lives of our population. This is a nice little slide that just explains how the system is subdivided. But what's really important is that although the people and the person is ultimately at the heart of everything that we're aiming to do, due to the large geographical area, different partnerships and delivery structures need to operate at different scales to keep a real finger on the pulse. So in a nutshell, we can describe the ICS as person, neighbourhood, place and system. What are the benefits to our staff? So think about them initially. So what we're aiming for is that work is less isolating and there's greater reward because we're feeling more included, more involved and more valued. There's less duplication and we're able to focus on areas of expertise. And there's more effective working because we're working collaboratively. There's a happier workforce and ultimately this is better for our patients. Our patients and service users are finding that there's improved access to the right people at the right time and there's more support to stay fit and well and focus on physical and mental well-being. What matters to you as the service user? Focus on the quality of services and what issues need tackling at that time, and asking involving the people, those people who actually know how that system should be working. But it's more than just access to health services, it's about working together to address all the factors that affect people's health, such as jobs, housing, education, environment, such as. So bringing that down to us and our jobs, I'll go back to Dan.
So Kate and I wanted to let you know a little bit about how the ICS has impacted on advanced practice within our ICSs. So Kate and I have both been recruited into the role as ICS ACP leads. So what does that actually mean? So for us, that means that we've been put there as the voice for the advanced clinical practitioners within our local areas to help support and signpost the services, the individuals into the right direction, into what we foresee as the future for advanced clinical practice. And for Kate and myself, one of the key drivers is making sure that we've got equality, fairness and standardisation across our ICS for our advanced clinical practitioners. That's looking at our educational needs and requirements, that's looking at standardising job descriptions, that's having a real standardised understanding of what advanced clinical practice is. And for that, we want to talk about our journey and where we're at the moment. So going into my place of work, so the Hereford and Worcester integrated care system. So we were at the very start of our journey, and for that I went into post in April this year and was with the remit of we want to standardise the advanced clinical practice standards across our region. So in order to make this happen, we wanted to then look at who are the right people to have around the table. So we started to look at stakeholder involvement, and from there started a steering group. So that steering group has met a handful of times now to really start to look at our ACP workforce and look at that understanding of what is the expectations and realities of what that workforce can and could go on to do. So from the scoping exercise point of view, we are coming to the end of that now. So we're starting to get a picture of where our ACPs are. But what it is really showing is how the role has started to develop quite quickly, how it's now being governed and directioned by the framework that was set out from HEE in 2017, but how one of the biggest things that has shown up is how the roles were quite ad hocly put into place. There wasn't very much workforce planning, there wasn't very much structure around the jobs and the expectations of where the role is going to go and what it will lead to. And therefore it has led to a bit of confusion and misunderstanding between the different partnerships and the different collaborative bodies. So therefore we are starting to draw together a memorandum of understanding. We in Hereford and Worcester have been quite fortunate that this has already happened in some of the places, such as such as in Nottingham, where Kate works, because we actually stole part of our memorandum of understanding from Nottingham and Nottinghamshire. So thank you for that, Kate. But basically that will enable us then to have a shared vision of what ACPs look like, and once we can get that understanding and that buy-in, then we can start looking at our 3-year strategies. How are we going to have that buy-in? How are we going to take it forward? What is that career progression look like through advancing practice? So we looked at our workforce models. So our workforce models, we broke down, some of you might have seen something very similar in some of the documentation that's recently come out, but basically looking at how we go from our root profession, quite a big group of people, how we then start to give them skills, knowledge, understanding, and then how they can progress all the way up to that consultant level of practice. And then exactly where advanced clinical practice fits in that. So in order to do that, we wanted to look at career structures and career frameworks. So we have built together a career framework of the routes into advanced clinical practice. So from this, you can see that there is a multitude of multidisciplinary posts and roles in place that can venture into advanced clinical practice. It's down there on the bottom of the slide. But how then you can advance into that enhancing and then that advanced level practice and beyond if so. And actually what it does show is that there is a lot of supportive documentation, a lot of supportive frameworks out there. It's just our role as ICS leads to bring that into those different bodies, into those different partnerships, and say actually we should all be working towards this. This is the standard that is recognised nationally, and this is where we want to go in the future. So we are quite new to the advancing practice in Hereford and Worcestershire, but we have big visions and big goals about standardising that out. And we can learn a lot from our system partners and neighbouring partners, such as those in Nottingham, and Kate, for instance. So I'm going to hand you over to Kate, who's going to talk to you a little bit more about how they've progressed through their journey.
Thank you very much, Dan. And this is our Nottingham and Nottinghamshire ICS. I apologise, it's a little bit fuzzy, but I think it still makes sense. So our ICS has been actually going for a couple of years now, and so that's probably why I'm in post. I've been in since May of 2021, and the system had been up and running already. I would say that the first priority that I had was actually trying to understand this system. This looks reasonably straightforward when it's put in a table, but I really do emphasise it's not. There are so many ifs, ands and buts in terms of how people work, and there are still people on here that are not quite included. They are under the text. For instance, GP federations, so they're non-for-profit and organisations that work very much within the PCN. So looking at who works for who and where funding comes from has been integral to actually understanding this system. So if you look at the top here, here's the ICS, and you have the partnerships underneath, and then there are the PCNs. So that is very much primary care. And then here are the foundation trusts, the NHS trusts, with 3 main hospitals, and then we've got 2 areas here where Nottinghamshire Healthcare Foundation Trust is written. They're written twice because one area is mental health and one is as a community provider, and this includes forensics. And then their colleagues, the Nottingham City Care Partnership, also provide community healthcare. Of course, we've got East Midlands Ambulance Trust, and then under that we are very much closely engaged with the County Council and the City Council, and there you've got the various smaller groups. The beauty of this is this is paramount as an ICS lead, knowing that you've got everybody in your group of stakeholders and contacts where you're having those conversations. And this next slide shows how our ICS ACP steering group, which was already it was already formed before I joined. We've got a good cover of where people represent across our ICS. And over on the left hand side, I've included our allied health professional cabinet group and our higher educational institution team of both Trent University and the University of Nottingham are both part of they are both part of our ICS ACP steering group. So we have voices at that group from across the ICS. One of the most important things secondary to this was making sure, as well as stakeholders, that we actually understood where we have our workforce. Bassett Law has just joined us. This is where we're talking about the boundaries having been rejigged. Bassett Law used to be with South Yorkshire and now it's rejoined Nottinghamshire. But I can clearly say from our scoping exercise that Dan has alluded to that from 2021 we have got this number of advanced practitioners working in these areas. I can explain where they all are, and I can explain across the trusts, across the PCNs, across the practices, this is what we have. That was our 2021 scoping exercise. In 2022 we're redoing it because actually I think we're probably going to find figures are very much different. Our 2021 figures showed us that in community healthcare we'd got just over 60, in primary care we'd got just over 120, and in secondary care that was our biggest number, predominantly at Nottingham University Hospitals, NHS Trust, but we had got, I think, just under 180. In primary care we could say that we had 53 practices with advanced practitioners, of which most of them were down as nurses, and they were down as nurse practitioners and advanced nurse practitioners, but varying job titles in addition to that. And of the remaining practices, 79 actually didn't have any. As you can see over here on the right, many were nurses, and we're just beginning to pick up on allied health professionals becoming ACPs, or advanced practitioners as we're now beginning to call them, and physios predominantly the most. And our bottom right table is something that's work in progress of actually beginning to show where we're beginning to invest. When did you qualify as an advanced clinical practitioner? When did you start working as a qualified ACP? And you can see here that there's been a steady movement and then a sudden increase in the amount of qualifications just beginning to emerge. But by far last year we were very much aware that people did not understand advanced practice, as Dan has explained, and so this was our infographic of explaining it in more detail. It's not just nurses that can go into advanced practice, it's across the registered healthcare profession. We're very well supported by all of these areas of guidance, of governance, of assurance, but we're also working across all four of these pillars. And it was only when we started meeting key stakeholders in organisational leads, executive groups, where we actually started getting this conversation and this discussion really actively working. We spoke to clinical directors, we went to all PCN meetings, and actually that conversation started to just get people to understand. And probably one of the key biggest points was that it is not a nationally regulated profession, that actually that responsibility of the governance and assurance is with the individual and with the employer. And it was only when that understanding came that we actually really started getting people really engaging with us. It's really very interesting. And one of the biggest asks, probably across every single group, was please can you, from an ICS perspective, really put a handle on what would we say is the ACP minimum standard for qualified APs? And so that is where we come to the Memorandum of Understanding. and we can signpost, we can advise. This is very much guidance for employers. So you as employers mandate and regulate. We stick to our regulatory professional body, NMC, HCPC, to that regulation, but this is the guidance from an ICS perspective, and we cannot take full credit for this. This has come from our Somerset colleagues who had the similar memorandum of understanding. So this is going around the UK, great collaboration. But this is a poster that shows how advanced practice is in Nottingham and Nottinghamshire, and it's very much why work alone. Our ACP steering group has these key people, and the biggest champion that really helps support this is our medical lead, who's currently our chair. And when there are difficult conversations with medical colleagues, he has been a superb help, particularly at executive board level. We report directly to the ICS executive board and the learning development group and the cabinets. And what we've done here is we've explained in green, these are the jobs that we've set up already. These are the areas that we've actually got already working. And in blue, these are the areas that we're working on. There are lots of smaller groups, but this is where we are. So that was us in a nutshell. And it's a great job, and it's really paying off working together. Thank you.